onto atrial fibrillation, a very common heart rhythm problem. Something like 6 million Americans have it, and if you do any clinical work, you're bound to bump into somebody with atrial fibrillation at some point. In atrial fibrillation, there are lots of different little foci in the atria that are going off, and it's chaotic. There are also locations in the pulmonary veins that go off as well. And that creates a situation where there aren't really any clear P waves. Just kind of see a wiggling of the baseline, kind of like that. Let's look at slow response over here. So there's no real clear P wave activity, it's just kind of wiggling. And then the QRSs are happening relatively slowly, less than 60 beats per minute. So that's atrial fibrillation with slow response. Over here, we got atrial fibrillation with rapid response, and this is the same thing with the wiggling baseline. But then the QRSs are happening more frequently at a rate of greater than 100 beats per minute. There can be atrial fibrillation with a controlled response, and that would be if the rate were between 60 and 100 beats per minute. Atrial flutter. Atrial flutter is occurring in the atria because there's a reentrant rhythm in the atria. It creates a repeating P wave that looks like a sawtooth, which is the hallmark of this. So there's a sawtooth pattern in the inferior leads. And that's what I'm showing here with the green tracing over the P waves here. Atrial flutter is quite common. It's treated similarly to atrial fibrillation, but it's a lot easier for the electrophysiologist to take care of the atrial flutter and stop it. They can do a procedure where they break the cycle in the right atrium, and then that stops the atrial flutter from coming back. While you see the sawtooth pattern leads 2, 3, and AVF, in other leads it doesn't look like a sawtooth. So over here in V1, you can see the P waves are happening. There's no sawtooth, but they're all happening. And in this case, it's a rate of about 300 beats per minute, since there's one flutter wave for every medium-sized box, and that's typical for atrial flutter. Oftentimes, there'll be 2-to-1 conduction. What that means is that there'll be 2 flutter waves for every QRS, and over here, that's what's demonstrated. There's a QRS for every other P wave, so that means that the ventricular rate's going to be out 150. So it's very common to have atrial flutter with 2-to-1 conduction and a rate of 150 beats per minute. If you see an ECG with a rate of 150 beats per minute, think about atrial flutter. There's a solid chance that's what it is.